Hoje a gente vai falar sobre. Sorry. Today we'll talk about ventricular assistole and PEA, pulseless electrical activity. Well, ventricular assistole. Well, asystole means no, no, and systole means ventricular contraction. That happens because there is no electrical activity on the heart. Therefore, there is no ventricular contraction, leading to no cardiac output, aka no pulse. And that means instant death. And so the person dies immediately. There's almost you can do almost anything. And pulseless electrical activity is kind of the same thing. There is still electrical activity, but there is no pulse. It's like there isn't enough electrical activity to generate a pulse. There's no pulse. And that could happen because of tamponade, or there's a block because of chest trauma. But in the heart, normally they send a electrical signal and it contracts. That's called electromechanical coupling. And when there is no contraction, it's electrical mechanical uncoupling. And normally on the movies when they are flatlined, because in the EKG it's a flat line when there is no pulse, so they are flatlining. They're in the flat line. Uh, comes a guy like running on the door, and he gets the shock, and it's like clear. Then starts um, defibrillating the person. Yeah? Defibrillation. But that's not quite like it. It's just some movies. We have the shockable rhythms, which are ventricular fibrillation, VFib, when the heart walls are spasm, or pulseless ventricular tachycardia, when it's too fast. But when there is no, you can't do it. What you have to do is not for the non-shockable rhythms, is cardiopulmonary resuscitation, CPR. Um, you give vasoconstrictors so that the blood can go easier, and you consider the reversible factors, which are H's and T's. We'll talk just in a second. Yeah, no defibrillator. Right. Uh, how do I go to the side? So we can have hypovolemia, which is when you have a low volume of oxygen. Hypoxia, when you don't have good oxygen, aka carbon oxide. When you have too much hydrogen ions, so the pH lows and it's acidosis. You also can have hypo or hyperkalemia, which is when too little or too much calcium, which regulates the heart beating. Hypoglycemia, you have too little sugar, and hypothermia, when you have too little heat on your body. We say it's lower than 95 Fahrenheit or 35 degrees Celsius. And the T's, these are where the H's. Now the T's are toxins like drugs or medicines, cardiac tamponade, which we just talked. We have a myo, a we have a sac over here, a pericarditis, and it fills with blood, and then the heart can pump. It's like doing jumping jacks underwater. And we have tension pneumothorax, which is if you have a trauma to your chest, our our uh, home, not home, our lungs, our lungs, they have kind of like a sac, and air comes in and can get out, so it's under pressure. That will make the heart go a little bit to the side. and almost like a tamponade, but only for one side. We have also thrombosis, which is or a pulmonary embolism, which when you have a blockade.